So hey guys, welcome to my new video, and this is a very short video on cough pharmacology. So without any delay we will start the cough pharmacology. Now, what is cough? Before understanding the pharmacology, we should understand what is cough. Okay, so cough is nothing but it is a reflex which is produced due to irritants and accumulated secretions, okay, and in the air passages, and intention is to remove this secretion and irritants. Okay, so cough is basically a reflex which is intended to remove these irritants and accumulated secretions. Now we have the classes of drugs. Let me just first name them. We have lozenges, we have the demulcents. We have the expectorants, and we have the antitussive. One more class, an extra class I would like to add is bronchodilators. Okay, now you will wonder why bronchodilators, because bronchodilators are used in bronchial asthma. So why bronchodilators? So basically what happens is bronchodilators are used to relieve the bronchospasm induced cough. Sometimes what happens is the bronchus or the bronchioles, they produce some abnormal spasms, and that basically induces a cough reflex. Okay, so bronchodilators are given in some cases, okay, in like the bronchospasm induced cough. Now we will start with demulcents. Now demulcents further contains three classes. Okay, one is syrup, one is lozenges, and one is linctus. Okay, now syrup we all know, concentrated solution of sugar, okay, to hide the bitter taste of the medicine. Okay, now lozenges is a solid drug form. Okay, it is placed under mouth and sucked. Okay, it dissolves, okay, and the active ingredient is released. And active ingredients basically, it soothes the irritated mucosa. Okay, and one classical example, one day-to-day use of lozenges is the strepsils, packet which we get in the market. Now when you get the strepsils packet next time, observe the contents, it will state that it is a lozenge. Okay, and one name to be remembered is diclonine. Okay, one name. Now what is a linctus? So it is a viscous liquid. Okay, it is sipped. Okay, and it trickles down the throat. Basically it soothes the throat. Okay, same as lozenges. Then that's it for demulcents. They the main mechanism of action, we will write it here. It soothes the mucosa, or better we will write irritated mucosa. Okay, and how it does it? By increasing salivation. This is important. Okay, so the pharyngeal demulcents are basically the drugs which increase the salivation and it soothes the irritated mucosa. And what are the classes of drugs we get under demulcents? We get syrups, we get lozenges, and we get linctuses, in which syrup is a concentrated sugar solution to hide the bitter taste of the medicine. Lozenges is a solid dosage form. It is kept in the mouth and it is sucked and it stops the irritation of the mucosa. Linctus is a viscous liquid. It is sipped and it stops the irritation of the mucosa. And under lozenges, we have one drug named as diclonine. And main mechanism of action, increase salivation. Okay. Now heading towards expectorants. Okay, what are expectorants? So basically focus on this word, expectorants. We expect the cough to be thrown out. Okay, now how will it be thrown out? So basically we have two class of drug with two different mechanism, mucokinetics and we have mucolytics. Okay, now kinetics means increase in the movement. So this mechanism of action of mucokinetics is increase ciliary movement. So if ciliary movement is increased, what will happen is the cough will basically be moved out of the body faster. Okay, and we have only one drug. It is named as guaifenesin. Okay, now what are mucolytics? Lytics means breaking. So basically they will break the cuff and the thickness will be reduced. It will cause thinning of the cuff. So the mechanism of action is decrease thickening of cuff. Okay, we have a number of drugs under mucolytics. Okay, we have the ambroxol. Okay, you have seen, like, if the cough is infectious cough, many of the pediatric population specifically are prescribed with this ambroxol syrup. Okay, now we have bromhexine, then we have citrates, then we also have some bicarbonates. Okay, also we have one drug which is used now is N-acetylcysteine. Then we have carbocysteine. Remember this order: ambroxol, bromhexane, citrates, bicarbonates, N-acetylcysteine and carbocysteine. Okay, now remember one note. Okay, this ambroxol is a metabolite of bromhexine. Okay, so bromhexine, ambroxol metabolite. This is one note. And tell me one thing: if the thickening of the cuff is reduced, the logical side effect that will be observed will be, yes, increased secretions. Then increased secretion, which secretions we can observe? See, the face is involved, like indirectly, if the cuff is thin. Okay, So what will happen? It will come out of the nose, and what will be it called now? Yes, rhinorrhea. Okay, and it will also come out of the eyes sometimes. It is known as lacrimation. Okay, and all these drugs are oral drugs. Okay, oral drugs. Okay, now one more thing, they decrease the thickening of the mucosa. Remember one thing, ambroxol, bromhexine, citrates, they all, like, let me just write it. Mechanism of action of ambroxol, bromhexine. Okay, so they basically what do is they decrease the they decrease the thickening of the mucosa, and they increase by increasing the lysosomal enzyme. Basically, when it gets metabolized, it increases the lysosomal enzyme. Okay, it digests mucopolysaccharides, then decrease viscosity or decrease thickening in very common terms, and we see the cough is expected out. One mechanism is of carbocysteine. Okay, so what does this carbocysteine do? Carbocysteine basically it opens the disulfide bonds. Opens disulfide bonds in the mucoproteins. Okay, so decrease viscosity or decrease thickening. Okay, and we see the cough is out. So to sum up, we have expectorants, we expect the cough out of the body. There are mucokinetics, mucolytics. Mucokinetics increases the ciliary movement, and we have one drug, we have guaifenesin. Then we have mucolytics. In mucolytics, they basically decrease the thickening of the cough. We have ambroxol, we have bromhexine, we have carbocysteine, citrates, then we have bicarbonates, then we have N-acetylcysteine. We also have acetylcysteine. Okay, we will write it. Okay, let me just add one drug, acetylcysteine. And one note, bromhexine, when it gets converted to ambroxol. Side effects, logical side effects, increased secretion, so rhinorrhea and lacrimation. It is an oral drug. Now, the mechanism of action are two mechanism of action of two different drugs, bromhexine, ambroxol. They show increased lysosomal enzymes. By liberating them, they digest the mucopolysaccharides, they decrease the viscosity and the thickening. Now the carbocysteine, it breaks the disulfide bond in the mucoproteins, they decrease the viscosity or decreases the thickening, increases the thinning, and then we expect the cough out. Now we have the last class of drug, which is known as antitussive. Okay, so antitussives, basically it is divided into three types. Okay, what are the three types? So basically, which acts on opioid receptor, which acts on non-opioid receptor, and third is antihistamines. I always forgot this color coding. Drugs and drugs classes are for yellow. Okay, now opioid receptor positive, we know two drugs, very common drugs. We have heard it since our 11th and 12th. Morphine is given in cough, morphine, codeine. Now they acts on opioid receptor, basically mu receptor. Okay, now this suppresses the cough. We have one use of morphine and codeine, it suppresses cough. The effect is suppressing the cough by acting on medulla. And what does medulla have? Cough center. Okay, mu receptors. Now we know one effect is cough suppressant, but we have some other effect. It causes sedation. Not side effects basically, but it causes in general sedation. Again, it causes constipation. One more, we have colicky pain. But note this down, colicky pain is a side effect. Rest others are all effect. And contraindications. It is contraindicated in children. Okay, it is analgesic. And yeah, one more side effect is addiction. Okay, and addiction, note one point, codeine is less than morphine. Okay, we have non-opioid receptors, okay, which acts on non-opioid receptor. Which drug we have? We have dextromethorphan. Dextromethorphan. It is a NMDA receptor agonist. Okay, it is a centrally acting antitussive agent. Okay, now benefits. Let me just write the benefits in some box or something like that. So we have, it is not sedative, not analgesic. Okay, it doesn't cause addiction. No addiction. And other side effect such as constipation. Okay, so these are some benefits. Some books say it is little sedative, but some books say it is not sedative. Okay, now we have antihistamines. Okay, antihistamines basically they are anti-allergy drugs. So any allergic cough we give antitussive. Now in antitussive we have promethazine, we have chlorpheniramine, okay, they basically they produce symptomatic relief. Okay, now one more concept I would like to cover. Okay, rather two concepts: productive cough and non-productive cough. Okay, so now productive cough and non-productive cough. Tell me one thing, if it is a productive cough, okay, this is a question to you, if that is a productive cough, should it be suppressed or should it be eliminated? And if it is a non-productive cough, should it be suppressed or should be eliminated? Logically speaking, yes. In productive cough, it should not be suppressed. Okay, it should be eliminated. And what like drugs can we give or what are not given? Tell me the contraindications. Which drugs are not given? The antitussives, demulcents, or expectorants? Yeah, you are right. Antitussives are contraindicated. Why? So antitussives go to the brain. They are centrally acting, some like opioid receptor, non-opioid receptor. So they go to the medulla, the cuff center. They suppresses the cuff. So we do not need suppression. We need elimination because it is a productive cuff, a wet cuff. Okay. So antitussives are contraindicated. Non-productive cough, should it be suppressed or should it be eliminated? Yeah, it can be suppressed. And it should be suppressed actually. Okay. So tell me one thing. Sorry. It should be suppressed. So we can give antitussives in this case. Okay, and for treatment of productive cough we can give mucolytics. Okay, and productive cough basically means infections. Okay, and for like productive cough we give mucolytics plus antibiotics for elimination of the causative agent and mucolytics for elimination of the cough. Okay, that's it for this video. Thank you.